Intimate health is a topic that deserves more attention, yet it's often overlooked or surrounded by misconceptions. Every woman deserves to feel confident and informed about her body, but many aren't sure where to start when it comes to maintaining intimate health. Missteps in hygiene, diet, or routine care can lead to discomfort or more serious issues, making knowledge on this topic essential. In today's world, balancing busy schedules and managing stress often means health gets pushed to the side. Unfortunately, ignoring intimate health can lead to preventable problems such as infections, hormonal imbalances, or discomfort during intimacy. The good news is that with simple, science-backed tips, these challenges can be managed effectively. This video will cover 5 essential things every woman should know about intimate health, from maintaining proper hygiene to understanding the role of diet and regular checkups. These practical insights aim to empower women with the knowledge they need to prioritize their well-being confidently. Maintaining proper intimate hygiene is the foundation of intimate health. Daily care routines are essential, but the products and methods used can make all the difference. Washing the intimate area with lukewarm water and a gentle, unscented cleanser ensures cleanliness without disrupting the natural balance. Harsh soaps, scented products, or excessive scrubbing can strip away protective bacteria, leaving the area vulnerable to infections. The importance of pH balance cannot be overstated. The intimate area naturally maintains a slightly acidic environment, with a pH of around 3.8 to 4.5. Using products with harsh chemicals or fragrances can disrupt this balance, leading to irritation or an increased risk of infections like bacterial vaginosis. A practical tip is to choose cleansers labeled as pH balanced or specially formulated for intimate care. Life hacks for better hygiene include wearing breathable cotton underwear to reduce moisture buildup and avoiding prolonged use of tight clothing, which can create an environment conducive to bacterial growth. Additionally, always wiping front to back helps prevent the transfer of harmful bacteria. A study published in the Journal of Obstetrics and Gynecology Research highlights how improper hygiene practices are a leading cause of discomfort and infections. In light of this, paying attention to daily habits ensures better long-term intimate health. By focusing on gentle products, maintaining pH balance, and adopting healthy hygiene habits, women can feel more comfortable and confident while reducing the risk of preventable issues. Understanding the signs of potential intimate health issues is vital for early intervention and prevention. Common symptoms such as unusual discharge, persistent itching, or discomfort may signal infections like yeast infections or bacterial vaginosis. While occasional changes might be normal due to hormonal fluctuations, prolonged or severe symptoms require attention. Seeking medical help when symptoms persist is crucial. Ignoring these signs can lead to complications or chronic issues. A 2018 study in Women's Health Reports found that delaying treatment for common conditions significantly increases the risk of recurrence. Consulting a healthcare provider ensures accurate diagnosis and timely care. Preventative measures go a long way in reducing risks. Practicing safe intimacy, maintaining proper hygiene, and wearing breathable fabrics can help prevent common infections. A practical tip is to avoid douching, as it disrupts the natural microbiome and can exacerbate issues. Consider this. A famous case study of actress Angelina Jolie emphasized the importance of paying attention to health signals. Her decision to address her risks early saved her from potential complications. Similarly, being proactive about intimate health can prevent long-term problems. By recognizing symptoms early and adopting preventative measures, women can take charge of their intimate health and avoid unnecessary discomfort or risks. Safe intimacy practices are essential for maintaining both physical and emotional well-being. Using protective measures like condoms not only prevents unplanned pregnancies, but also reduces the risk of sexually transmitted infections. According to the CDC, consistent condom use lowers the risk of STIs by approximately 90%, making it a non-negotiable aspect of safe intimacy. Open communication with partners is equally important. Discussing boundaries, health concerns, and past medical history fosters trust and ensures mutual understanding. A practical tip is to schedule conversations about intimacy outside the bedroom, where emotions can be calmer, leading to clearer and more productive discussions. Post-intimacy hygiene also plays a crucial role in preventing infections. Washing with warm water and urinating after intimacy helps flush out bacteria that may enter the urinary tract. Avoid using scented wipes or harsh cleansers, as these can irritate sensitive areas. A case study involving public health campaigns in Sweden demonstrated the effectiveness of educational programs focused on safe practices and open communication. These initiatives significantly reduced STI rates and improved overall awareness of intimate health. By combining protection, communication, and proper aftercare, women can ensure a safe and positive experience while minimizing health risks. Diet and lifestyle choices significantly impact intimate health. Foods rich in probiotics, such as yogurt, kefir, and fermented vegetables, support a healthy microbiome, which is essential for maintaining balance. Hydration is equally important, as even mild dehydration can contribute to dryness and discomfort. A practical tip is to drink at least 8 glasses of water daily to promote optimal hydration. Exercise improves circulation, which is vital for intimate health. Activities like yoga or walking increase blood flow to the pelvic region, promoting healing and reducing discomfort. Additionally, staying active helps regulate hormones, reducing the risk of conditions like PCOS. Stress management is another critical factor. Chronic stress disrupts hormonal balance, leading to irregular cycles or other health issues. Incorporating mindfulness techniques, such as meditation or journaling, can significantly reduce stress levels. A 2020 study in Health Psychology Review showed that women who practiced mindfulness reported improved overall intimate health and fewer symptoms of hormonal imbalances. By adopting a balanced diet, staying active, and managing stress, women can enhance their overall health while supporting their intimate well-being. Routine checkups are the cornerstone of preventative intimate health care. Regular Pap smears and STI screenings help detect issues early, reducing the risk of complications. The American College of Obstetricians and Gynecologists recommends Pap smears every 3 years for women aged 21 to 65, emphasizing early detection of cervical cancer. Vaccinations, such as the HPV vaccine, offer additional protection. HPV is linked to several types of cancers, and getting vaccinated significantly lowers these risks. According to the World Health Organization, widespread HPV vaccination could prevent up to 90% of cervical cancer cases. Building a strong doctor-patient relationship is essential for maintaining intimate health. Open communication with a trusted healthcare provider ensures concerns are addressed without judgment. A practical tip is to prepare questions in advance for appointments, ensuring all concerns are covered. By staying proactive with regular screenings, vaccinations, and open communication, women can take control of their intimate health and prioritize long-term well-being. Maintaining intimate health requires a combination of daily care and proactive measures. Focus on proper hygiene by using pH-balanced products and avoiding harsh chemicals. Pay attention to symptoms like discomfort or unusual discharge, and seek medical advice promptly. Prioritize safe intimacy practices, including protection and effective communication, to reduce risks. Diet and lifestyle choices also play a significant role. Incorporate probiotics, stay hydrated, and exercise regularly to improve circulation and support hormonal balance. Manage stress with mindfulness techniques to prevent disruptions to intimate health. Finally, schedule regular checkups, screenings, and vaccinations to stay ahead of potential issues. By implementing these science-backed strategies, intimate health becomes manageable and sustainable. These small changes lead to long-term benefits, empowering women to feel confident and in control. Prioritizing intimate health is essential for overall well-being, and these tips make it simple and achievable. Thanks for watching. Let's support each other in creating healthier habits and making informed choices. Don't forget to subscribe for more valuable insights, and share your thoughts or questions in the comments below. Let's grow together.